In this video, I will discuss some of the basics of the thyroid gland that may be informative to anyone wanting to build their understanding of the thyroid. Specifically, I will address the way the thyroid moves from the tongue to the neck during development, thyroid hormone production and regulation, and thyroid anatomy. I will go into moderate detail in this video, and to keep the length manageable, I will speed up the video in parts. The thyroid gland makes thyroid hormone and calcitonin. Calcitonin plays a minor role in calcium metabolism. Thyroid hormone plays a much greater role in our health. Thyroid hormone circulates in the blood, coming into contact with receptors on various tissues of the body. Thyroid hormone affects nearly every tissue in the body, and in general, I like to think of it as a sort of go juice for the engines of the body. Without enough thyroid hormone working, many aspects of the body slow down, which may cause a feeling of weakness or fatigue, weight gain, a feeling of coldness or not tolerating cooler temperatures, dry skin, dry hair, slower heart rate, slow wound healing, and many, many other symptoms. In contrast, too much thyroid hormone revs up body metabolism, noticeable as feeling hot or not tolerating warmer temperatures, rapid heart rate, anxiety, a fine hand tremor, unintentional weight loss despite good appetite, and many, many other symptoms. Suffice it to say, we need our thyroid hormone to be in the normal range for our bodies to work well. The thyroid gland is normally located in the low neck, in the midline, just about where the knot of a necktie would be. The thyroid gland produces two hormones, T3 and T4. Collectively, these are called thyroid hormone. These molecules include iodine. T3 has 3 atoms of iodine, T4 has 4 atoms of iodine. And this is the only part of the body that uses iodine. We get this iodine from our diet. An adult only needs about 100 micrograms of iodine per day, which is easily exceeded by our typical dietary intake in North America. Dairy, seafood, especially shellfish and tuna, and salt, as long as it's labeled iodinated, have iodine in them. Regulation of thyroid hormone output is controlled by a negative feedback loop, kind of like a thermostatic system. The hypothalamus gland in the brain secretes thyrotropin releasing hormone, which is transferred to the anterior pituitary gland. The anterior pituitary secretes TSH into the bloodstream. When this molecule is in contact with its receptor on thyroid tissue cells, it activates a series of changes that increase production and secretion of thyroid hormone. Levels of circulating TSH are under control by the thyroid in a classic negative feedback system. As levels of thyroid hormone rise in response to TSH stimulation, thyroid hormone blocks the thyrotropin releasing hormone from the hypothalamus. A typical way of assessing how much thyroid hormone is being produced is to check the TSH level from a blood draw. When TSH is high, thyroid hormone level is low, and when TSH is low, thyroid hormone level is high, typically. In summary, the thyroid gland makes thyroid hormone, which works on many different organs and systems in the body. Thyroid hormone production is regulated by a negative feedback loop. Too much thyroid hormone in the blood makes the pituitary secrete less thyroid stimulating hormone, which lessens thyroid hormone production. And too little thyroid hormone in the blood causes the pituitary gland to secrete more thyroid stimulating hormone, which leads to an increase in thyroid hormone production. When this regulation system is broken in one way or another, someone may get too much thyroid hormone circulating, hyperthyroidism, or too little thyroid hormone circulating, hypothyroidism. Testing for hyperthyroidism and hypothyroidism is usually done by a blood draw assessing not thyroid hormone directly, but the amount of its upstream regulatory hormone, thyroid stimulating hormone. And for that, it's important to know that a high thyroid stimulating hormone level means low thyroid hormone, hypothyroidism. And a low thyroid stimulating hormone level means high thyroid hormone. The thyroid gland migrates to its final destination in the low neck. The cells that become the thyroid start in the tongue, about 2/3 of the way from the tip of the tongue to the deep extent of the tongue in the throat. The thyroid cells pass through the tongue and through or very close to the hyoid bone, and then reach their final destination in front of the trachea or windpipe. A separate kind of cell is also added into the mix. These cells, called neural crest cells, migrate into the thyroid and intersperse throughout the upper portion of the thyroid gland. These cells can't be seen without a microscope, and they produce a hormone, calcitonin, which is different from thyroid hormone made by the remainder of the thyroid gland. The thyroid gland is composed of two lateral lobes connected by a central isthmus, weighing 15 to 25 grams in adults. The thyroid lobe usually measures 4 centimeters in height, 1.5 centimeters in width, and 2 centimeters in depth. The thyroid gland is located in the low anterior neck, in close relationship to the larynx or voice box, and trachea and esophagus, the carotid artery, the internal jugular vein, the vagus nerve and its branches, and structures of the upper chest. Let's talk about the thyroid and surrounding anatomy. This is the neck, the chin, and the thyroid gland in the midline. Above the thyroid gland is the thyroid cartilage, also known as the voice box, and within which are the vocal cords. The cricoid cartilage is just below that. Higher in the neck is a bone suspended by muscles, the hyoid bone. In brief, the vascular anatomy can be described starting from the aorta, which is the main blood vessel emanating from the heart. There is some relevant asymmetry in that on the right, the aorta gives rise to the innominate artery, which then branches to the right common carotid and the right subclavian artery, whereas on the left, the common carotid artery branches directly from the aorta, and beyond that, the left subclavian branches directly from the aorta. The abundant blood supply to the thyroid comes from above and below on each side. From below, the thyrocervical trunk departs from the subclavian artery and splits into 4 arteries, one of which is the inferior thyroid artery, which enters the thyroid gland from below. From above, the blood supply to the thyroid comes from the superior thyroid artery, which is the first branch of the external carotid artery on each side. And this vessel makes its way down to the superior lobe. The special significance of the asymmetry in the vascular anatomy relates to the course of the recurrent laryngeal nerve, which is the main nerve that allows proper movements of the vocal cords. On the right, the vagus nerve travels down the neck in contact with the carotid artery, past the thyroid, and then the recurrent laryngeal nerve branches, turns around, and travels back up the neck to come into close proximity to the inferior thyroid artery before traveling on the deep surface of the thyroid gland before entering the larynx and connecting to the vocal muscles. On the left side, the same pattern occurs, except the blood vessel that the recurrent laryngeal nerve loops around is the aorta itself, lower in the chest. There is one additional muscle of the larynx that is innervated on each side by a different nerve branch. The superior laryngeal nerve, external branch, also arises from the vagus nerve, but this limb branches away from the vagus much higher in the neck, and its destination is a muscle outside of the larynx on the cricothyroid muscle. And this muscle is useful in allowing one to reach the high pitch range of voice. The internal jugular veins run along the carotid arteries on each side, and classically there are 3 main veins from each side of the thyroid that branch off and drain into the internal jugular veins, which then drain into the subclavian veins. We typically have 4 parathyroid glands on the undersurface of the thyroid gland, although they can be highly variable in location. They can be within the thyroid gland, behind the esophagus, up higher in the neck, down in the chest, or they can be on or behind the carotid artery. They're also very small and colored just slightly darker than the surrounding fat. Based on the normal anatomic location of the thyroid, you can guess some of the implications of thyroid problems. More detail will follow in separate videos on specific scenarios. First, a lump, irregularity, or growth of the thyroid may be noticed by an individual or their physician. Second, swallowing problems, albeit common in general, are not commonly due to the thyroid because the windpipe, or trachea, is between the esophagus and the thyroid. And unless the thyroid is very large and expanding around the back of the windpipe, it typically doesn't impinge on the esophagus and swallowing. Third, surgery on the thyroid gland involves close dissection to the parathyroid glands, which regulate calcium, and the nerves to the voice box. Lastly, thyroid hormone production is regulated by a feedback loop that is like a thermostat. If the system is broken or the thyroid gland is removed, treatment of some sort is necessary. More on this later. That's all I have for this video on the thyroid gland. Please add comments below. Look for other videos on my channel. Feel free to subscribe, and if you like the video, feel free to give me a thumbs up.